Good morning, everyone. It's so great to be here. I'm just really grateful for this opportunity to share with everyone today some updates of all of the transformative work that we're doing in North Dakota, and also share some new initiatives that are just beginning in the state. So first and foremost, I'd like to draw your attention to the slide behind me. 6 years ago at our first Recovery Reinvented event, we announced the development of a new program, Free Through Recovery. After assessment, it was clear that North Dakota had significant gaps in recovery support services. Individuals could often access treatment, but there were so many services that were missing. And we would consistently hear from individuals that the difficulty was in things like transportation to and from those services, access to housing, childcare, and having someone who could walk alongside you, someone who had lived experience that really understood the path that they were experiencing. And what we knew is that often those gaps were barriers to things that could be really helpful, like starting employment. And so we needed a program that would help and fill those gaps. For example, we would hear from individuals that they had employment, but before they could begin their job, they would need steel-toe boots. But there was no way in order to actually get those services or products or whatever it was that barrier. So by working together with the Department of Corrections and Rehabilitation, the Department of Human Services, developed the program Free Through Recovery. So one of the main things that program focused on was integrating core correctional practices with best practices in behavioral health. And the goal was not only that we would be supporting individuals seeking recovery, but that people would have access to quality service and those connections. And so from that, Free Through Recovery was born. Wanted to share a little bit of information about some data in North Dakota. We know that when we look at the behavioral health population and the criminal justice population, we have a lot of overlap. You've already heard that mentioned today. This is data directly from the Department of Corrections and Rehabilitation. We know that 95% of women entering correctional facilities in the state have an active substance use disorder, and 91% of men. And when we look at mental health diagnoses, we see 52% of women and 40% of men are experiencing the same. So for us to have the idea that somehow these are two separate systems, it really is something that we need to continue to address. By focusing on individualized goals, Free Through Recovery in that model has allowed for flexible services where we meet people where they are. We are consistently seeing outcomes that are achieved at about 68%. One of the unique things about Free Through Recovery is that it's an outcome-based program, which means that we reimburse not for sickness, but for wellness. We want to encourage that, not that we're doing something that costs a certain amount of dollars as a provider, but that we're gonna pay for things that are achievable, like improvement in recovery, improvement in your criminal justice status, being able to maintain housing, and have all of those other things that are so important. And so if you saw on the previous slide, there's 4 key components that we look at with Free Through Recovery. To date, 5,952 individuals have been served through the Free Through Recovery program. We have 57 care coordination providers, and these are the providers providing services through Free Through Recovery. And it's so important that we recognize the need to build that capacity within our system. We also currently have 1,542 participants, and so the program continues. One limitation of the program, however, is that Free Through Recovery is a program for individuals who are already involved in the criminal justice system. And so one of the things that we identified many years ago is the need for that program and those types of services to be available to a broader audience. So in order to move forward and develop that program, we went back to the legislature and said, we really see that this program is effective and it's addressing a need in the state. And so in February of 2021, we launched Community Connect, a program that is based on the same model as Free Through Recovery, but an opportunity to serve so many more individuals and citizens within the state. So we currently have 3,226 participants in Community Connect. And so far, since February of 2021, the program has been able to serve 6,738 individuals in our state. And again, we currently have 59 care coordination providers, so continuing to build and grow that infrastructure that's so important for us as we build out our behavioral health system. Next, I really wanted to provide an update about peer support. In early 2018, North Dakota was selected to participate in SAMHSA's program called Bringing Recovery Supports to Scale Technical Assistance Strategy, or Technical Assistance Center Strategy, otherwise known as brass tacks. And if you look at the picture in this slide, you'll see the team from North Dakota that traveled to meet with other states and learn about the work that was underway relating to peer support. This team focused strongly on the need to develop a peer support infrastructure for North Dakota, because in 2018, we didn't have any of the things that really developed that structure that we needed. These are the 5 key areas that we focused on as a team. We wanted to see training developed in the state, certification and reimbursement, and seeing peers be integrated into already existing systems, emergency departments, right, treatment, and all of those different services where there was already infrastructure. And lastly, for there to be a robust network of peer support specialists. So I want to give you an update of where we are today since the beginning of that, from a vision in 2018 to the current action. To date, we have trained more than 900 peer support specialists in the state of North Dakota. We actively have 259 certified peer support specialists in the state. And next, one of the most important and systemic changes was looking at how we can ensure that peer support is treated on an equal footing as the rest of the behavioral health providers and services. And so reimbursement for peer support services exists today in North Dakota through programs like Free Through Recovery, Community Connect, but also the Substance Use Disorder Voucher, North Dakota Medicaid, Medicaid Expansion, and most recently, Blue Cross Blue Shield Commercial Insurance. The next 2 items, again, looking at how we can integrate peers. We know that today we have peers that are actively working and being reimbursed through the SUD voucher because they are employed through treatment programs. They're working in the emergency departments and all of the other high-risk places. North Dakota Department of Corrections and Rehabilitation, county jails. So again, really focusing on the integration. And lastly, I want to make sure to share with everyone that there is a North Dakota Peer Support Association of North Dakota. They are here today. They have a booth. And if you, yes. I strongly advise you to take a chance and connect. They have a website that's also available here on the screen, and to really become engaged in that network. It's so important for peers to be able to advocate and have a voice, learn from one another, and offer support. So it's really great to see that elevation of that association. Next, as we were talking about reimbursement, I wanted to share some information also about our substance use disorder voucher. In 2016, the state legislature supported the development of an SUD, or substance use disorder voucher, in order to ensure that financial barriers would not be a concern for citizens seeking help. The voucher provides individuals the opportunity to access services from a private provider of their choice, and 63% of the voucher participants report an increased community connection after receiving services. To date, 6,660 individuals have accessed the voucher, and we have 35 private providers that are enrolled in providing those services, both from treatment services to those recovery services and many of the supportive things like transportation. Next, we also have a program that's fairly new. The Recovery Housing Assistance Program was established in May of 2022 with the primary goal to increase access to safe, secure, and supportive environments for individuals in recovery. To date, 556 people have been served by this program. We have 12 providers and 30 recovery homes across the state. One way that this program measures success is through looking at our outcome measures of the participating individuals. Through these measures, we've learned that individuals can find stability and success through stable housing. 33% of participants saw reduction in the degree to which their substance use was affecting their quality of life. 37% saw improvement in their mental health status. 71% maintained or improved their substance use status. 60% saw improvements in their employment status with an income growth of 194%. 67% saw improvements with criminal justice involvement. 78% saw improvement with their use of emergency room for non-emergent needs. 84% of those that used IV drugs saw improvement in their IV drug use. And 92% saw improvement with their overdose risk in the past 90 days. So I wanted to share some North Dakota data also specific to the work that we're doing around overdose. When we look at the funding and some of the work that we've been doing, both with the Opioid Settlement Advisory Council and the work from the federal grants that we've already been receiving, like the state opioid response funding, just from October of 2022 to July of 2023, we distributed over 19,000 naloxone 2-disc kits throughout the state. We know 708 of those kits were used for successful overdose reversals. And now to talk about a few of the items that are new items that are happening in the state based off this last legislative session. The first is that the division has contracted with Avel eCare to expand crisis services through first responders in our rural areas and tribal nations. This contract will allow first responders immediate access to telebehavioral health services to assist in resolving crises and establish follow-up care. Next, we also receive funding in order to ensure that women are able to access treatment services with their children. And so we will have an opportunity to fund 2 women's and children's programs that are residential in nature in the state of North Dakota in the next 2 years. We also received funding to include 10 additional inpatient behavioral health beds in the Williston region to be able to deal with acute issues like withdrawal management and the need for mental health services in that region. In addition, the division has contracted with integrated telehealth partners to provide support for the jails across the state of North Dakota. These jails will be providing services to individuals that have a behavioral health need in the jail. These services can be provided, medications if needed can be prescribed, and this will provide a support that currently is often a long wait. I want to thank the jail administrators for bringing this issue forward and working to address this during the last legislative session. We have just finalized the contract this week and we'll be able to begin that work. And I did want to make sure that everyone here today has an opportunity to look at North Dakota resources. We have a lot of opportunities to connect. In a crisis, we have our 988. We have a mental health directory where you can go in and actually search for a mental health provider that provides services that you're looking for, whether or not they take your insurance or other form of payment, and be able to know exactly where those services are located. We have the same thing for our addiction programs. And lastly, our Recovery Talk program, which is a 24/7 support where you can call and speak with someone who has lived experience. Lastly, I just want to share that if you are not aware of our Parents Lead information and resources, I would encourage you to look at them. As a mother, I often am struggling with what does prevention look like for a 2-year-old or an 18-year-old? How do I do effective prevention with my own children? And having resources that help me know what those things are that I can do is just something that has been such a meaningful tool for me. Parents Lead has resources on our website, and I'm going to share a quick video that talks a little bit about what's available. Thank you.
One unique thing that Parents Lead offers is that we hope to break down information into those small tidbits. We're parents who deal with daily struggles, just like any other parent, and we really strive to bring in information and share it in a way that is digestible.
Parenting is hard for all of us. Providing those little resources that we can share for those conversations that are hard to have, using those unique tools and making them applicable to our environments is key.
Behavioral health is health. It covers everything from emotional health to physical health. As parents, we're always trying to do the best we can, and we want to raise healthy, vibrant kids.
I think my favorite thing about Parents Lead is that breakdown of what is something that I can do today to support the behavioral health of my kids.
The support that Parents Lead provides allows us an opportunity to gain a better perspective on our attitudes, our beliefs, and really encouraging constant communication with our children.
I think that's unique in that there's not this big plan that you have to follow, but it really is meeting parents where they're at, which is busy lives, day to day, trying to figure out what's for supper, getting kids where they need to go, and trying to remind parents of those little things that you can do in the midst of those busy schedules.
I'm a father of a 7- and 8-year-old, and there's information even that addresses behavioral health at that young age. As parents, we're just on a journey, and we're just trying to do the best we can. And what Parents Lead does is provide support along the way. What Parents Lead offers is very age-appropriate information that's accurate and relevant to parents in North Dakota. People can find out more about Parents Lead by visiting the website. That's parentslead.org.